go. Hi guys, Tegan here from Albanese Physio. I've got Laura helping with me today as well. What we're talking about is management and exercises for low back pain. This is part 2. Our first session was done by Jason a couple of weeks ago, and he talks about diagnosis and symptoms of low back pain. What we're doing is exercises, early stage exercises for either acute back pain or sort of chronic non-specific low back pain. Please remember, if you do have a more sinister diagnosis or something pathology-wise that has not been checked, make sure you do get that cleared by your physiotherapist. These are general exercises to promote mobility and stretching, range of motion of your lower back. Most of the time they are appropriate for what we call non-specific low back pain, but it is important that you get that checked out by your practitioner first. First thing we're going to do is we're going to come into this position that Laura's in. What we call this is crook lying. And anytime we have low back pain and our legs are out nice and straight, even just the weight on those legs can put a little bit of pressure through our lower back. So generally coming into this position, we find that people with low back pain will like that. The first exercise that we're going to be doing is what we call a pelvic tilt. Now I'm going to get Laura to, with her thumbs, find the bony parts of her hips. So if you're kind of standing or you're lying down and you're able to feel them, that's a really good orientation point of what we're trying to do. Essentially with our pelvic tilt, what we're doing is we're rocking our pelvis backwards and forwards. So I'm going to get Laura to start with her pelvic tilt here. Now she's quite good, she obviously does this a fair bit with Pilates, physio, those types of things, but the best way or the easiest way I like to explain it is if you've got your bony parts of the hips, you're trying to rock them up towards your rib cage. We see that now as Laura comes into posterior tilt, and then as she moves those bony parts of her hips or rocks them in the opposite direction, that's what we call an anterior tilt. And with this one, you just want to comfortably go backwards and forwards. If you find a little bit of a pinch or a pain part, just reduce your range of motion. We don't want to move into overextension. We don't want that middle of the back to be arching up off of the bed, but we just want to gently go backwards and forwards. And this should feel quite nice. If you are symptomatic, generally it's quite safe to do. And often this is the type of exercise that you more do. The more you do, the better you will feel, and it will get easier as you go. Okay. Second exercise, once again, it's a very small movement, and we're going to do a side lying rotation. So what we're going to do is just get Laura to move her knees a little bit, side to the right, then side to the left. What we're doing here is nice, gentle rotation or rocking of that lumbar spine or lower back. And what we see sometimes is people will want to drop their knees all the way to the edge of the bed, and you'll see that as Laura does this, her hips lift off, the sort of lumbar and even the upper part or the lower part of her thoracic starts to twist. We don't want to go that far while we're in pain, we just want to move nice and gently side to side. As your symptoms improve and you become less painful, you can go through a bigger range of motion, but early on it's nice and safe just to do little rocks backwards and forwards. Okay? Nice and easy, everything in the same position. The third and final exercise that we're going to go through today is a bit of a stretch. What we're going to do is get Laura to hug her knee in towards her chest. So by doing so, what she's doing, thanks for dropping that leg, is just getting a little bit of a stretch through the back of the glute, and she's actually bringing her hips into a little bit of flexion and a little bit of a pelvic tilt as she does that as well. If she's quite symptomatic and can only go a little bit of a way, she can hold here or she can pull in. Basically, you're going to whatever range is comfortable. Be holding that stretch for sort of 10-15 seconds, something like that. We're not looking to really pull. Remember, these are for early stage low back pain, but a comfortable resistance or a comfortable stretch. We'll get Laura to swap the sides here just so you can see a little bit closer, and she's just pulling that in whatever range is possible. When she is in pain, she can actually leave this opposite leg here, but for the purpose of today, we're obviously just trying to show you what it looks like from side to side. Once again, this knee bend position is just nice and comfortable for the lower back. Okay, and we can have a relax from there. In terms of reps and sets, this is the kind of thing that if your back is sore, we would encourage you to do this 5-6 times a day, something like 15 to 20 repetitions each time. There is no upper limit. You can keep doing these, they're quite safe, provided that it is relevant to your back pain, but lots of movement as often as possible, or little bits of movement as often as possible, is what we try to encourage.